Hi, I'm here today with Lynda Jones, who is a medical herbalist, naturopath, and reflexologist. Hi, Lynda.
Hello, Steve. Nice to meet you.
And you. Now, tell me about your background. No, tell me about your actual background there, your physical background. What is going on in the background there? Those
Okay.
bottles. I take it that is medical herbs there and
Yeah,
medicine. Yeah.
it is. So each one of those bottles contains a different plant, and they're tinctures. Tinctures are a water and alcohol extraction of the whole plant. So, for instance, marigold, the marigold tinctures are made by soaking the plant in a water and alcohol solution for several weeks or months. So I'll go and get one of them, shall I?
Yes,
Okay.
absolutely.
So here we are. So this is Johns Wort tincture, and the
All
Latin
right.
name for that is Hypericum perforatum.
Now, let me
And
ask a quick question on that. Are the European Union trying to ban St John's Wort or get rid of it or reduce the sale of it? Or I thought I'd read something on that. No,
they're always trying to do that with
are
herbs.
they? Yep.
Mm.
Okay.
That's often the case with herbal medicines. It's often the ones that have been extensively researched, um, and the thing with St John's Wort is that this is whole plant extract of St
Right.
John's Wort. So it
Mhm.
is just St John's Wort in its natural state
Mhm.
that has been soaked in a water and alcohol solution
Mhm.
for maybe 3-4 weeks.
Mhm.
And I buy my herbs commercially from suppliers who only supply medical herbalists, and so they're doing this commercially. But if you can imagine that it's just, that it's a maceration essentially, and they're in different strengths of alcohol depending on what you're wanting to extract from the plant. So if there's a lot of essential oil in a plant, you would need 45% alcohol. If there isn't, and you're just looking for a preservation of the plant, then it's like 25% alcohol. If you're trying to extract resins or gums from a plant, then it'll be 90% alcohol. So it's like a chemical process, really. But what you end up with is a bottle that has everything within the plant sort of in various quantities.
Could,
Okay, so this is Hypericum tincture, Hypericum perforatum, which is St John's Wort. And it's a tincture is essentially a water and alcohol solution of a herb. So it's an extract, and it the amount of alcohol that is used by the manufacturers of tinctures
yep.
depends on the constituents within a plant. So, for instance, if there's a lot of essential oil within a plant, then it will often be tinctured with 45% alcohol.
Yep.
And if there isn't, then it will probably be 25% alcohol, because that's the alcohol level that you need to preserve the plant material. The people that run the companies that medical herbalists buy from, they know all that. That's their bag. That's their
Yeah.
specialty. That's yeah. So yeah, we know how to use them as herbalists, but we trust them to know how to create the very best medicine for us to be giving our patients.
Okay. And the naturopath side, the naturopath, is that linked to the medical herbalist role?
Well, I think it's more, for me, it's more about the way that I practice. So when you're training as a medical herbalist, which is what I've done, it's a Bachelor of Science degree, and we learn all about the herbs and about how to treat holistically in terms of making sure that all the parts of the body that need to be supported are supported. So like the nervous system or the adrenal glands, or the liver, or the eliminatory organs, the skin, um, and that's how you generally, as a medical herbalist, are trained to treat holistically. And in my opinion, and in my view, a naturopathic herbalist also uses the energetics of the person and the plant. So we're looking at whether or not somebody's condition is related to an excess of heat or cold or damp or wet or
Yes.
dryness.
Yes.
And we're looking, I would say that's why I refer to myself as a naturopathic herbalist, because I work in that way. I work in sort of pulling in old traditions and stuff. I'm not necessarily an Ayurvedic practitioner. I'm not a Chinese herbalist. I'm not a Unani Tib practitioner, but I will use that same, I'm a Western herbalist, but I will use those same principles, but maybe
Yep.
using different words.
And what kind of things would people typically come to you for, Lynda? What would be, you know, when you get a knock on the door or an email in your inbox, what are the typical things that people are looking to for you to help them with?
If you're talking about new patients, often it's people with quite complex conditions. So, you know, things like Lyme disease comes to mind, rheumatoid arthritis, ulcerative colitis, digestive problems, menopause. I treat a
Hmm.
lot of women who are going through the menopause, and also other gynecological, not that the menopause is gynecological, but you know,
Yeah, yeah.
sort of I've also gynecological problems, people that are suffering from polycystic ovarian syndrome, pain, regular periods, heavy periods, other hormonal conditions, male hormonal conditions, prostate issues, that sort of thing. Essentially, I treat people, and people often come to me because they've been recommended. I'm really fortunate that I've been in practice for quite a while now, and I do get a lot of recommendations, and I get recommendations throughout the country as well, which is really nice. So being able to do video links these days is really helpful.
Definitely. And you're in Kent, you're in Folkestone in Kent, is that
Yeah,
correct?
right at the end of the country.
Right, okay. So people can, you also do reflexology, and that's a sort of hands-on treatment, isn't it?
It is. In fairness, though, Steve, my books are almost closed really for reflexology. I'm so busy with that, which is good. So, and I
Yeah.
have to keep the balance. I mean, I consider myself to be a general practitioner in the herbal medicine, so therefore I need to be available for my patients.
Hmm.
You know, if they've got queries, and also, you know, keep that flow of new patients coming in. And so,
Hmm.
I only have so much room for the reflexology, and I'm pretty busy with that. But yeah, it's
Yeah.
great.
And with regards to the patient client, do you call them patients or clients? Or
Patients normally.
yeah, and you treat it, you treat yourself as a sort of general practitioner, but
Mm,
with a completely medical herbalist naturopath slant on it.
mm, yeah, definitely. And that's how a lot of, I mean, I'm fortunate to have, goodness me, I couldn't guess, but 10, 20 um, regular people. Well, I've got a lot more than that in terms of regular clients, but I've probably got about 10 to 20 people who use me like their GP. So they've been seeing me 15 plus years, and that anytime anything, you know, and they might have a regular medicine from me for whatever it is that I was originally helping them with.
Especially nowadays, I suppose, Lynda, where people can't access their
Mm,
GP, you know, being able to do a Zoom call. Does it translate well to Zoom that, you know, you can talk to people and
absolutely.
diagnose and fact find? Yeah.
Very, very much. Very, very much so. I mean, I was doing it before, you know, this past couple of years, um, but more so now. And some prefer to come and see me face to face, and I'm easy either way, really. It works. It works. Yeah, it
Yeah.
works really, really well. You can't actually physically examine someone over Zoom, though. You know, you can't take their blood pressure, you can't take their pulse, you can't
Hmm.
look into their eyes in the same way. Um, but that is a small part of what I do. And if I felt that that was absolutely vital to treatment, then I wouldn't take somebody on.
Yeah, absolutely.
Mm,
Well, the good thing there is then you've got clients throughout the UK who can
mm,
tap into your level of expertise. You
mm,
know, people need this type of service just now, Lynda, and that's the challenge that they're facing. You know, they've kind of lost confidence in many ways with the NHS, let's put it
mm.
that way, and the traditional doctor. They're not getting what they want anymore.
People aren't being heard. And I think that that's the thing that people say when they've had a consultation, because the first consultation with me is an hour. So, and follow-up consultations are 30 to 40 to 45 minutes. That's a lot of time in which to talk. And people often say that they've never ever spoke as much about their, you know, their health and
Yeah.
how they're feeling and their problems. So it's, and you know, you need that. You need to be heard. Yeah.
It's like going private without the cost, because I'd imagine your costs are reasonable for
I think
people. I mean,
so.
yeah, and I think people are happy to pay. I mean,
Mm.
they need something. What's it? Okay, you get a free service from the NHS. Is it free? Is it helping? Are people being cured there? You know, are there problems being solved? Are they creating more problems with these jags and things out of bottle and pills? And you know, are they actually helping them?
Yeah, and you know, and I do that as well. You know, with it, sometimes people come and see me, and they're feeling that it's absolutely necessary to take pharmaceuticals, and herbs can sometimes help the body to process the pharmaceuticals as well. You know, it can it can buffer the body, and so you know, you can look at it that way too. You know, that
Yeah,
if somebody is taking a medicine and it's causing them side effects, then herbs can increase the resilience in the body so that it's able to cope better and reduce
yeah,
the side.
yeah,
Sometimes when, because I see a lot of people with menopausal issues, and sometimes hot flushes can come about through people taking too many pharmaceuticals, you know, because it's quite hard
yeah.
on the liver. You can help the flushes by giving the liver some support.
And is that like the liver overheating or working too hard, or yeah?
Yeah, exactly that. Yeah, because the liver creates, when it's working hard, it creates so much heat in the body.
And how would it work then in practice? Okay, so let's say I wanted to connect with you and start the process. What would the typical client journey, patient journey look like?
Generally, they email me or they'll call, and I will usually then, because I like to be really transparent, I'll normally email them with this essay sort of thing that I created a few years back now that explains what I do and how I do it. And it's
Yep,
called Medical Herbalism Demystified, because
yep,
I want people to know how many consultations they're going to need, what it's going to cost them, um, what I'm looking for in the consultation, how long we're going to be, and everything that they need to know before they part with their money and book their appointment. And if things are a little complicated, then we will have 10 minutes on the phone before they even book an appointment, just so that they can see whether or not they resonate with me, and we can explore a little bit more about whether or not I would be able to help. We book an appointment, and then the first appointment, we spend an hour talking, and I ask all about the problem that they have, the condition that, or the situation that leads them to come and see me in the first place. And everything they have to say about that, I want to hear. Then I might
yeah,
ask
that's
some
good.
questions. You know, I might say, well, you know, how long have you had this? And if anything makes it worse, anything makes it better? Those types of questions. And what have people tried? And then I'll ask, you know, sort of about any history of that, or I'll ask any family history. And then I'll ask lots of questions. I'll ask about diet, I'll ask about lifestyle, I'll ask about pharmaceutical medicines that they might be taking, any allergies that they might have. And then I will ask about the rest of the body, because I want to know about the rest of the body.
Yeah,
If you're experiencing something in your digestive system, then there may well be a link with what's going on in your nervous system, you know, if
yeah,
you're stressed, etc. So I want to know everything. And mostly the hour is enough. And then I've got all the information, all the time I'm talking to, or rather I'm listening to my patient, then I'll be making a mental note and writing down the types of herbs that I think might help
yeah, yeah,
situation that they're in. And
yeah,
then towards the end of the consultation, I've got a rough idea. I'm
yeah,
probably 80 to 90% there of what I want to include.
yeah, yeah,
And then I will talk to the patient about what I think might be going on, why it might be going on, and what if I can make sense of a situation in a consultation, we are 60% there. And then what I try to do is explain my thought processes to the patient, and then
Yeah,
that
that's
get them
important.
on board. Yeah,
Yeah,
so
yeah.
they understand what's going on and what I'm trying to do.
And they would feel good about that, you wouldn't they? You know, having been listened to, and
Yeah.
it looks like you're on the case. You know, you've got a train of thought. You know, you're
Mhm,
diagnosing, you're
mhm.
fact finding, you're planning, mapping out a plan. That's
Yeah.
got to feel good at the receiving end, that you're on the case.
Yeah, absolutely. And what happens is I then have this list of herbs, and then I decide how much I want to use, and of each herb. So it's a recipe. We call it a recipe, because it is. It might have 5, 6, 7 different herbs in it at different quantities, depending on their the therapeutic dose, what the client needs, and also the balance. They might need more support for their nervous system than they do for their digestive system. They might need support for their adrenal glands and some support for the liver. And so it all goes in, and then I mix up. That all goes in one bottle. So I will mix all of this together, usually about 4 or 5 weeks supply. And I put it in one bottle, and I either give it to them if they're face to face, or I post it to them if they are not within easy distance.
Yeah.
And then what happens is we book an appointment for close to when that medicine's going to run out.
Hmm.
And the follow-up appointments really generally are comparing where you are compared to where you were.
Yeah. And do
Yeah.
you find that a lot of them, don't take this the wrong way, I would imagine you would have a very good strike rate, but you're not a miracle worker as such, and that you. So, what kind of success rates would you see typically after that period of time? Would you say?
Mostly some,
Yeah.
mostly some. So because people don't come back, if if they're not better. So you really want to. What I do at the end of a consultation, I am looking to, one, manage the client's expectations, the patient's expectations, but also to establish from them what are the most important things.
Hmm.
What is going to make a real difference to you? Because they might have 15 different things going on that I could potentially help with. But what I need to know is what's most important to them.
Yeah.
And that's where I will tailor my first treatment.
Yeah. Yeah.
It's not that I will ignore everything else, because I won't, but we need to be able to have something tangible to make a difference with. And then we build on that as the consultations go on. Sometimes, though, sometimes I don't even prescribe herbs. Mostly I do. But if I think somebody's situation can be helped by a change in their diet, and they are on board with that, because not everybody is, but they're on board with that and they're open to changing their diet, then that's what I will suggest they do. If they're on board with it, we'll then give that 4 weeks. Sometimes, certainly in some cases of hay fever and asthma, and skin problems in particular, those 3 things in particular off the top of my head, eczema, that sort of thing, changes to the diet sometimes are enough. And why would I want to prescribe herbs that somebody has to pay for when
Hmm.
just changes to their diet can help?
Yeah. And do you think people are just reluctant? They're creatures of habit. They don't have the willpower to really change their diet and stick to the program, or do you think sort of taking a couple of teaspoons of a medicine out of bottles, herbal medicine out of bottles, easier for them to do than it is to change something as difficult as their diet?
I think it's some and some, really. Some people are really motivated to change their diet, others not. I mean, I am honest with people. So, for instance, if I don't, especially some skin conditions, some skin conditions, if you don't change your diet, you're
Yeah.
probably not going to get better.
Yeah, so really the prize is great if you listen. They've really just got to listen to the advice, and if they want, they're knocking on your door to find a solution, and you're giving them it, so they might as well
Right.
grab it with both
As I say
hands.
that, and I'll say that to them, Steve. I say, look, this is what you pay me for. Dietary changes in particular, and not, not everybody's keen, but
Yeah, I get that. I'd probably
it's
not be that
a
keen if you were telling me to change my diet, but I would probably listen for
Mm.
sure. And I think it is important, and I think people are more open-minded now than they've probably ever been in, you know, history. I think to really listen to this and to get this side of it right and get the, you know, let food be thy medicine type thing. You know, they really need to start thinking like that. I think diet comes into it a lot, doesn't it? You
It
know,
does.
you
And
probably
it's
touched
quick.
on it a lot.
It's quick, Steve. You know, and that's the beauty. You know, I'll often say to people, give me 3 weeks. Just give me 3 weeks. You know, this is if with their diet, and I'll say, you know, just take this out, take that out, play with this, play with that, you know, sort of give me 3 weeks. And if you know better, then don't worry. But because often dietary changes, if you're making dietary changes in order to improve somebody's health, it's quick.
It's funny how the doctors never ever talk about this, don't they? Not they just never ever bring it into play at all. It's all out a bottle or out a needle and nothing else. But listen,
Yeah.
that's been brilliant today, Lynda, to chat to you. We've got a good
Mhm.
picture there of what you do, and I think a lot of the people who watch this will be in touch with you. It's all about getting to know you, getting to know the person that they're going to connect with, and these videos do a lot to help them resonate and understand, you know, the person who can help them. And there's a lot of people needing a lot of help. So, Lynda, thank you for your time today. It's been an absolute pleasure. I might contact you myself. Actually, I like what you do. So, thank you very much for today. You're an absolute star, and well done.
Thank you.